A 75-year-old woman with a 5-year history of chronic obstructive pulmonary disease comes to the office because of a 1-month history of progressive shortness of breath with exertion and a non-productive cough. Current medications are formoterol, tiotropium, and supplemental oxygen. She purses her lips with the effort of breathing while seated in the examination room. She appears anxious. She is 5'8" and 180 pounds. Her BMI is 27. Her pulse is 105. Respiration's 18. Blood pressure 140/85. Breath sounds are decreased bilaterally. Results of arterial blood gas analysis on 2 liters of oxygen via nasal cannula is shown. pH of 7.37, a PCO2 of 58, and a PO2 of 80. If this patient has normal kidney function, what is most likely stabilizing her acid-base balance? Please put your answer into the chat. So we have all of your answers. Let's ask the students first about your approach to this question without the option set and how you came to your answers.
You can read the question at the end before reading the anecdote on the patient. You can almost like direct yourself towards that answer. And then once you read the anecdote, kind of confirm the answer that you might have in your mind. It's very easy to get lost in the weeds in what they're talking about, the patient's presentation, and then having to read the question and go back through and kind of get the important information out of that again.
I definitely would agree with that. Sometimes I go through these questions and I pick out what might be important, and I see the question and I may have to go back and readjust my focus. So with this particular question, when it asked about her kidney function, it kind of put me in the direction of thinking about compensation and respiratory compensation versus chemical compensation.
When we were going through the question itself, I would have something in my head and the next sentence would just get rid of it. It would be like, oh, this is what's going to happen. And then the next line would be like, nope, nope. Until I finally got to the end and it was like, oh, well, this is all that's left because they've given me all the labs. They've given me all this information. We really had to weed through my thought process on the way down.
They kind of hinted that it's the kidney function, which is normal. It kind of then makes you start thinking about if they have given you something that is a crucial organ for acid-base balance. You start now thinking into, like Brittany suggested, what are the mechanisms that are responsible for maintaining those balances?